There are many forms of LDN. Can we explain the different forms? And then there's another question saying, is there a sustained release or levo presentation of LDN?
I think we've spoken about most of the different forms of LDN and the reasons why that you would want to have them. I think if there is a dose formulation, you'll find a way to make it. And certainly in the US, maybe not in the UK, it's a slightly different environment. But yes, I would love to have an eye drop, but no one will make me one. But yeah, the different forms are really about whether or not you are absorbing well. So we started off going from capsules to liquids to allow for titration better. We then looked at sublingual dosing, which is the same as you use for CBD, to potentially bypass first past metabolism, but also to avoid GI side effects directly. But since then, we now have seen here that there are sublingual pellets, which look very exciting, which I've seen various people make. Would also love some of those in the UK, and we'll hopefully have a wee conversation about that later.
Yes.
But yes, so many different creams. What I'd be interested in is what bases you find in creams get the best penetration and dosage.
Without getting into trouble with our CE provider, we can have that conversation in the hall. Or you can come and ask me after, but that's for CE. We do see transpercutaneously enhanced absorption creams can be different than regular creams. They have penetration enhancement technology. We also see different topical administration having different components for enhanced specific use. So when we're looking at products that are going to be used topically versus vaginally, we may have different compositions as well. So, and then with eye drops, there's pharmacists in the room that can help you with those probably today. So I'll hook you up. And I'm also going to talk a little bit about the levo versus the dextro. My understanding currently is that there is no dextro isomer commercially available anywhere. There was a discussion about it being synthesized and then used, but it went nowhere because they didn't understand the application. Now the patent has run out, so no one's going to pursue $1 billion cost for a drug that has no patent protection. And so this is a very difficult discussion, but it makes it very available. But also, now I'm going to go back to Stephen's presentation, we don't want only one isomer because we lose so much value in using a single isomer only. Because in many of these patients, it's not just one of these systems. If you suppress, outright suppress, life will find a way through a different receptor system. And the TLR systems are overlapping receptors. The opioid receptors are overlapping systems. And so if we suppress one outright with too high of a dose, the other ones will come online. And this is why the dosing has to be seen, because if you overdo it, it kicks up and you lose functionality. So does that hopefully that answers the question from whoever is asking. But yeah.
I just had a tag. So your nasal spray experience with the fire ants, the burning.
I have a super sniffer now.
Is it?
I can smell what you had for breakfast 3 days ago.
Not being a pharmacist, did that have anything to do with the pH of the preparation, or was it simply the naltrexone, you think?
So the question was pH. So with that formulation, naltrexone at those concentrations don't have a significant impact on pH. And I've had low pH products used intranasally as well. I'm the guinea pig at work. Full disclosure, my wife works in the R&D lab. She's the smart one, and they just put me on stage because I talk a lot. So yes, and so they're like, here, taste this. Here, try this. Here, put this up your nose. And I'm like, really? So yes, I am the guinea pig. The low pH has a wildly different burn, and if you taste naltrexone, it's extremely bitter. And so some people talk about this sort of slight irritation right away, even in incredibly low doses where there's no pH change. That's the issue. But it's naltrexone, for some reason, just has that sort of effect. But again, some people are like, I felt it, it must be working.